Our patients ask us about all this buzz they hear of psychedelic medicine, ketamine, psilocybin, all these different things. So we took it upon ourselves to really deep dive into this, and we were overly convinced that ketamine has potentially a very strong tool. So many people, either yourself or a friend or family member, out of control. We have depression, anxiety, PTSD, some people with chronic pain, all these syndromes. And what happens is we go to your medical provider and they say, what do you have? Anxiety. Well, here's a pill for that and see ya. So the problem is, how many people are improved when they take their medicines? And I'm not saying don't take medicines. It's very appropriate for some people, but how many people, your family members, are better, functioning like they could be just by taking a pill every day? So is psychotherapy something that should be important? Yes. Maybe should physical activity, nutrition? Yes, all those things. But for some people, this is the whole evolving world of psychedelic medicine. And with it, so specifically ketamine is one, and it's been used forever. I mean, we use it in veterinary medicine, we use it in military and emergency trauma medicine. It's a wild thing. It does great things. We can use it for sedation, we can use it to relax people. But in the past 10 years, it's been evolving as also somewhere in the middle of a little bit and a lot is this magic little zone of psychedelic effects. So what happens is it's twofold. There's a psychedelic part, and then there's a biochemistry neuroplasticity part. And they're both fascinating and both equally powerful. So for some people with even a little bit or significant trauma, physical, emotional, we get stuck in a rut. And I heard it described as going down a hill in the snow, and me and you go, and we go down in our sled, and we go down once, and then twice, and 3 times. Over time, you start making a little bit of a divot into the snow, and next thing you know, you're stuck. I'm like, I want to go to the left, but it always goes straight or right, and I have no control, or it seems that way. So what happens is sometimes they find with psychedelic medicine that it's kind of like putting a little fresh snow on that path. Maybe I can jump out and go a little to the left. And that's what we do in our minds. We have this negative default mode where whenever this thing happens, this trigger, we respond. And we always respond the same way. And we want to break it, but we can't. And that makes me even more angry and whatnot. So the psychedelic aspect of it, the experience, maybe I can find a new way to do it, and I can see things differently, and I can just put down some of the baggage that I'm carrying and find the person that's within, who's always awesome. And then the neuroplasticity part is that snowy hill. Maybe we can just change that pathway. And it's been fascinating. We found it's not always this drastic, thankfully, but some people are suicidal. And I'm not saying this is magic. You need a whole team, but as part of the treatment plan, a tool. Like when you want to build a house, a hammer isn't the only tool. We use drills, we use saws, we use nails. Same thing with your care. We should use nutrition, physical activity, social support, friends, a psychotherapist perhaps, maybe some medications, but maybe some psychedelic medicine. So we've been working on this for a while now, and it's just fascinating. It's so exciting to see people go from despair to excitement. And we just had someone the other day who, it's funny, he said, in 30 years, he said, I love cooking, always loved cooking. I haven't been in the kitchen in 30 years, and I'm back in the kitchen. And that, to me, that's something that is powerful. So it's not to say any of the other things are negative. It's not a competition. It's a challenge to try to get the best outcome.